Pharmacists are calling for greater integration of traditional medicine and indigenous knowledge into Nigeria's health system as part of efforts to improve access to safe and affordable drugs. They are also urging the federal government to officially recognize and designate community pharmacies as primary healthcare centers across the country. These calls came during activities marking World Pharmacists Day organized by the Pharmaceutical Society of Nigeria, FCT branch. Our correspondent has more on the story.
As Nigeria joins the rest of the world in commemoration of this year's World Pharmacists Day, marked by the Pharmaceutical Society of Nigeria (PSN) Abuja branch, pharmacists have reignited discussions around the profession's relevance, accessibility, and integration into the country's health policy framework. Speaking at an event to mark the occasion, Chairman of PSN Abuja, FAM, Salamatu Orakwelu, stressed that pharmacies are more than dispensers of medicines.
Research, innovative research, that we're talking about researching the molecule that is being used in the formulation of this same medicine that we use from scratch to finish. We are accessible. We are pharmacies that are accessible in the sense that we ensure that drugs are available, they're available, affordable, and at the same time effective to the populace. Manpower, that's brain drain, and also in the financial aspect. Those are challenges, and we're also calling on the federal government in this regard. Funding is actually a challenge when you talk about the research and even the availability of medication, which our colleague actually spoke about it here.
On the role of pharmacists in primary healthcare, Chairman of the Association of Community Pharmacists of Nigeria, FCT, FAM Aloba Olatunji, explained why pharmacies remain the most accessible health facilities in many communities.
We have the primary healthcare system that mostly they are being manned by what we call, I think the CHO. CHO means community healthcare officers. And if these people are given that responsibility to manage primary health care, then why will you not think of giving such a bigger responsibility to pharmacists to handle? That is number one. And I will tell you that this community health care officer that we're talking about, they are being trained mostly in their ranking by pharmacists.
Also speaking, Secretary of PSN FCT, FAM Godwin Oko, emphasized the importance of collaboration across the health sector, noting that community pharmacies often serve as the first point of care for many Nigerians.
Because we are found in various locations, the nook and cranny. And in situations like this, what is primary health care? Primary health care is the first care to any patient. And since we are very available, very accessible, we automatically become the first point to reach. And it's an international standard already. All over the world, pharmacy is already a primary healthcare center. What the national chairman is asking for is not a new outcome to Nigeria. It's an international standard.
For his part, the zonal coordinator of the West African Postgraduate College of Pharmacists, Dr. Abubakar Daranka, said pharmacies also play a key role in integrating traditional and alternative medicines into mainstream practice.
As pharmacists, what we are doing is as much as possible to harness our indigenous knowledge systems in every community in Nigeria, every location you go. We have what we have been using to manage our ailments, basic ailments. So pharmacists are at the forefront, canvassing that such knowledge should be standardized and made to be recognized. Already, the Federal Ministry of Health has a Department of Traditional and Alternative Medicine headed by pharmacists. So collectively with our colleagues in the academia, recently, I'm sure you are aware, our colleague in University of Osman Danfodio University made a presentation of some herbal remedies that can cure brain cancer. So what we are saying is that pharmacists are leading the conversation to harness our indigenous plants, medicinal plants, to cure remedies, and at the same time, standardizing the available herbal remedies to be safe for use by Nigerians.
Stakeholders say this year's commemoration of World Pharmacists Day is a reminder that pharmacists remain indispensable in achieving safe, effective, and affordable health care for all Nigerians.